RSV is an abbreviation for respiratory syncytial virus, a common virus that mainly impacts the respiratory system. RSV infection can affect people of all ages, but is especially predominant and can be more severe in young children, particularly infants. In the United States, RSV is responsible for 2.1 million outpatient visits every year in children less than 5 years. This video explains important information about RSV infection in children, including the symptoms, treatment, and prevention. Welcome to Pediatric Doctor at Home, where parents and caregivers can get accurate medical information for their children from a board-certified pediatrician. If you get any value from this or any other video here, a subscription would be much appreciated. RSV is highly contagious and spreads through droplets released into the air when an infected person coughs, sneezes, talks, or breathes. The virus is also transmitted when children rub their eyes, nostrils, or mouth after touching a contaminated object or surface. RSV usually causes seasonal outbreaks. Although outbreaks can vary by region, infections generally start in the fall, peak during the winter, and then taper down in springtime. Almost all children get infected by the time they are 2 years old, and it is not uncommon for reinfection to happen. Having RSV does not necessarily protect against another infection. Children who attend daycare have a higher chance of contracting the virus, as well as those with older siblings who may be carrying the virus without showing any symptoms. Typically, RSV is diagnosed when a doctor asks questions and examines the child, although a confirmation can be done by testing a sample of the nose secretions. The symptoms of RSV infection in children can range from mild to severe. In older children, the symptoms are often mild and resemble a common cold with runny or stuffy nose, coughing, sneezing, or low-grade fever. However, symptoms can be more severe in infants and children with certain conditions. In severe RSV, the infection progresses to the lower airways and lungs, causing fast breathing, wheezing, and an increased effort while breathing. RSV infections can lead to bronchiolitis, an inflammation of the small airways in the lungs, or pneumonia, which is an infection of one or both lungs. Dehydration can also happen from RSV because of very poor appetite or difficulty feeding. Risk factors for severe RSV disease include being younger than 6 months of age, being born prematurely before 35 weeks gestation, being born with a heart defect, having an underlying lung disease like asthma or cystic fibrosis, having a weakened immune system, and being exposed to secondhand smoke. In terms of treatment, there is no specific antiviral medication for RSV, so treatment typically focuses on relieving symptoms and providing supportive care. At home, even if the appetite is decreased, make sure the child continues to drink in order to avoid dehydration. Use saline drops and suction the nose as needed to lessen congestion. Pediatricians do not encourage the use of over-the-counter cough and cold medicines as they are not really safe for children. Note that antibiotics do not treat infections caused by viruses, they take care of bacterial infections instead. Give fever-reducing medications as needed to keep the child comfortable. Watch for red flag symptoms that require prompt medical care. If you notice that your child is struggling to breathe and getting tired, or has bluish or dark lips, fingers, or skin, it most likely indicates that there isn't enough oxygen getting into the body. When a child refuses to eat or drink for a long period, or urinates less often than usual, or cries without tears, it is concerning for dehydration. Children with severe symptoms usually require hospitalization for oxygen therapy and other supportive measures. That said, consult your child's doctor for any concern you have about your child. I bet your pediatrician is more than happy to address your concerns and provide guidance on managing RSV infections. Preventing RSV infection in children involves basic hygiene measures, including the following: frequent hand washing. Teach older children how to wash their hands properly. Anyone in contact with children, especially those with high-risk conditions, should wash their hands regularly or use an alcohol-based hand sanitizer if there is no easy access to soap and water. RSV can survive for several hours on surfaces, so wipe down play areas, doorknobs, and clean toys after use. Stay away from sick individuals as much as possible. Practice cough etiquette. Cover the nose and mouth with a disposable tissue when sneezing, coughing, wiping, or blowing the nose. Then discard the tissue immediately. If tissues are not available, cough or sneeze into your upper arm or sleeve. Do not use your hands. Keep children away from tobacco smoke or people who smoke. In some cases, healthcare providers may recommend a medication called palivizumab or Synagis to help prevent severe RSV infections in specific high-risk infants and children. Parents and caregivers of young children should be vigilant about checking for symptoms of RSV, especially during the peak RSV season, and seek medical attention when necessary. Thank you very much for watching. Don't forget to subscribe, like, and share. Goodbye for now.